If you've been scrolling through endless listings, watching video after video, and still feel stuck wondering which patient lift actually makes sense for your situation, you're not alone. I've been there, staring at the specs and wondering if the premium label really translates into everyday relief, or if I'm just adding another piece of equipment that will sit in the corner gathering dust. Link is in the description if you want to check the product details on Amazon. In the next few minutes, I'm going to walk through the Coisioke electric patient lift, point out where it shines, where it falls short, and help you decide if this is the lift that will actually make a difference in your day-to-day routine. Let's start with the big picture. Patient lifts sit at the intersection of safety, convenience, and cost. For families caring for an aging parent, a home health aide, or even a small clinic that needs to move patients without a full-size hydraulic system, the main worries are usually threefold. First, can the lift handle the weight without wobbling? Second, will it fit through the doorways and hallways of a typical house? And third, does the battery last long enough to get you through a shift without constantly plugging it back in? The Coisioke model tries to answer all three, and it does so with a design that leans heavily on aluminum framing, a folding mechanism, and a battery advertised for long-lasting use. The aluminum keeps the overall weight down to 103 pounds, which is light for a lift that can support up to 440 pounds, but it still isn't something you'll want to lift over your head without a second pair of hands. If you're the primary caregiver for a loved one who weighs under the 440-pound limit and you live in a house where space is at a premium, this lift could become a real workhorse. The folding design means you can store it in a closet or even the trunk of a vehicle, making it a viable option for families that travel to visit relatives or need a portable solution for multiple homes. I imagined a scenario where a daughter lives 2 hours away from her mother's apartment. She could load the lift onto a small SUV, drive up, unfold it in the living room, and safely transfer her mother from the couch to a wheelchair without calling a professional service each time. That level of independence is exactly what the Coisioke team seems to be targeting. On the flip side, the lift's 103-pound weight means you still need a bit of muscle or at least a second person to maneuver it into position before you power it up. In my research, I noticed that many users of heavier, steel-framed lifts appreciate a push-button-ready experience where the device can be rolled into place with minimal effort. With the Coisioke, you'll likely need to enlist help to roll the base onto the floor and lock the wheels before you engage the motor. If you're a single caregiver who doesn't have another set of hands nearby, that could become a practical bottleneck. Now let's talk about the silent powerhouse claim. In the home environment, a motor that whirs loudly can be unsettling, especially when you're already dealing with the stress of moving someone with limited mobility. The Coisioke's motor is indeed designed to run quietly, and from the video demos I watched, the sound is barely audible over normal conversation. That quiet operation makes it easier to use during nighttime transfers without waking the rest of the household, which is a subtle but meaningful benefit for families who need to maintain a regular sleep schedule. Battery life is another area where the product tries to stand out. The lift comes with a large capacity battery that the manufacturer says will last through multiple transfers on a single charge. While the exact runtime isn't spelled out in the marketing material, the fact that the battery is described as long-lasting suggests you won't be tethered to an outlet for most typical home use. If you're planning on using the lift for a full day of caregiving, say, moving a patient from bed to chair, then to the bathroom, then back again, you'll probably need to recharge it at some point. But the intervals should be far enough apart to stay out of the way of daily tasks. Just keep in mind that you'll need to manage the charger and plan for a recharge window, which could be a logistical consideration if you don't have a dedicated storage spot near a power outlet. Ergonomics also get a shout-out. The lift's harness and the way the platform folds are meant to accommodate a variety of body types, from frail seniors to larger adults who still fall within the weight limit. The adjustable straps and the padded sling make it easier to get the patient settled without awkward twisting. In a real-world setting, that translates to fewer chances of strain on the caregiver's back and a more comfortable experience for the patient. I could picture a scenario in a small assisted living facility where staff rotate between rooms. The lift's easy-adjust harness would cut down on the time spent fine-tuning each transfer,